Yeah, exactly.
Are there any supplements that can help?
Okay.
There's so much information out there about different vitamins and minerals.
Right. Let's talk about collagen. It's literally the most common protein in our bodies. It's like the glue holding everything together. But here's the thing. As we age, we make less of it. And then during menopause, that decline really speeds up.
So that's why our joints hurt more and our skin sags, like our body's scaffolding is getting weaker.
And that's why supplementing with collagen could actually be helpful. It's like giving your body the building blocks it needs to, strengthen that weakening structure.
Now, you've also got some research on glucosamine and chondroitin sulfate. I feel like I always hear those two together, right?
Yeah, glucosamine, you can think of it as like the raw material for cartilage repair. We already have it in our bodies, but taking more of it can give our joints what they need to fix damaged cartilage.
And what about chondroitin sulfate? What does that do?
That's more of a protector. Imagine it's like a shield around your cartilage, stopping it from breaking down. So it works with glucosamine to make sure your cartilage stays healthy overall. And there's research that shows using them together is actually helpful. It suggests that these supplements can really make a difference for people with osteoarthritis.
That's great to know. Now, I also see some research on calcium and vitamin D3. Those are pretty essential for strong bones.
Definitely. Calcium is like the building block for your bones, and vitamin D3 makes sure your body can actually absorb it. Especially for women going through menopause, when their estrogen levels drop, calcium and D3 are really important because that's when bone loss is more likely.
Makes sense. So we've got collagen, glucosamine, and chondroitin, and calcium and vitamin D3. I'm noticing two more things here. Magnesium and zinc. Do those play a role in joint health too?
They do, yeah. Magnesium is really important for your muscles, helping them function properly and relax. Think about it. If your muscles are always tense, that pulls on your joints and can cause pain. Magnesium can help ease that tension.
So it's like addressing the muscle tension that makes joint pain even worse.
Precisely. And then there's zinc. Zinc's really important for your immune system and for how your body repairs itself. And we know that inflammation is a big part of joint pain, especially with something like arthritis. Zinc helps to control that inflammation and helps your body heal naturally.
So all these supplements, they're working in different ways, but they all contribute to the same goal.
Yep.
Less joint pain.
Absolutely. Which brings us to our last supplement for this part of our deep dive, curcumin.
I keep hearing about how it's a powerful anti-inflammatory.
And that's true, it is. Curcumin's a really promising natural remedy for joint pain, especially for things like arthritis. You even have a study there, curcumin and curcuma longa extract in the treatment of arthritis, which backs that up. But there's something important to remember here. Regular curcumin is not absorbed well by the body.
So even if you take a lot, you might not be getting the full benefit.
Exactly, and that's where nanocurcumin comes in.
Nanocurcumin.
It might sound futuristic, but it's a simple idea. Nanocurcumin uses nanotechnology to make it easier for your body to absorb curcumin. Basically, it breaks curcumin down into tiny particles so it can get into your bloodstream more effectively.
So it's like making curcumin more available to your body.
Exactly. And because it's more bioavailable, nanocurcumin can be more effective at fighting inflammation in your joints.
Many of these ingredients have been studied individually for joint health, but the real impact comes from combining them in the right way. If you'd like to know when we release the Timeless Radiance Joints formulation based on this research, you can sign up for updates. Link in bio.
We focused heavily on the physical aspects here.
Yes.
But I think it's also important to acknowledge the mental and emotional side of things too, right? Menopause is a big life change and it can impact women in so many ways.
That's a very important point because menopause isn't just a physical event, it's a holistic experience. And all of those hormonal shifts can really affect mood, energy levels, sleep, even your sense of self can change.
So it's not just about achy joints, it's about how you feel overall.
Exactly, and these emotional and psychological aspects can actually influence how women perceive and manage their joint health too. For example, if someone is really struggling with low mood or anxiety because of the hormonal changes, it might be harder to find the motivation to exercise to prepare those healthy meals that we talked about. And that's why I think having that kind of holistic approach to menopause care is so important. It's not just about addressing the physical symptoms, but also acknowledging and supporting the emotional well-being of women who are going through this transition.
So how can women navigate these emotional and psychological challenges?
Well, I think first and foremost, it's about awareness and self-compassion, recognizing that these feelings are normal and common during menopause is huge.
Yeah.
It's not a sign of weakness, it's just a natural part of the process.
It's about normalizing the conversation.
Absolutely.
Yeah.
Breaking down that stigma and shame that often surrounds menopause.
That's for sure. Now, menopause, it's a journey, not a destination. It's a time of change,
Yeah,
but it's also a time for growth and empowerment.
it really is.
Before you go, don't forget to subscribe. Once we hit 1,000, YouTube lets us add timestamps, making these videos even easier for you to navigate. Thanks for being part of this science-backed wellness journey.